All right, so I've had numbing cream on for about 45 minutes. Everything feels really numb. It feels like when you're at the dentist and you can't really feel your mouth or your teeth.
That's good. So I usually wipe the numbing cream off kind of in sections so that she can still be is that okay?
Yeah.
All right, so we'll get this off of this side of her face before we get started.
All right.
Do we want to invite any questions to come our way, or?
If anyone has any questions for Tracy about microneedling, feel free to chime in.
All right.
So I know y'all said that someone mentioned they wanted to see more like non-invasive treatments, because I talk a lot about surgery. So this microneedling with radiofrequency. Can you talk about maybe the difference between that, like
Sure.
regular microneedling versus with radiofrequency?
Yeah, so I always describe microneedling with radiofrequency as kind of microneedling on steroids. This is a little bit more intense. With the needles, it's actually 24 needles that's going to penetrate the skin, and it's going to send the radiofrequency underneath the dermis there. So it's a deeper treatment. It's going to be stimulating more collagen, more so than just the kind of superficial microneedling session. Both have a place and both are important. This just tends to be a little bit more strong. All right, just about got you cleaned off here. So we'll kind of work in this section that I've wiped off first.
Okay.
Does it feel like I got you cleaned off pretty good?
Feels like it.
Okay.
It's pretty good.
All right, this is just a dry gauze just to get you dry. You burn them?
Mm-mm.
Okay.
So you wipe off. You kind of wipe off with gauze and then alcohol. And then,
Yeah, I do.
okay.
Yeah, I
Just
want to
kinda
get you
clean.
nice, and I don't want any of that stuff on there. Okay, and so I've got a little ice with me here if we need it. So this is going to be the tip that we're going to use here. So this is kind of how that's going to go. All right, Dr. Mock, I'm going to have you turn like this,
Okay.
and you're going to feel a couple little test spots. Ready?
Mhm.
1, 2, 3.
Okay.
Are we good?
Yeah, it's really not bad.
How would you rate the pain?
I would say, let me think, on a scale of 1 to 10, maybe like a 3, 3.5.
3.5?
Mm-hmm. Like I can feel them, but it's not like, it's not bad.
Okay. You're doing beautifully. So I kind of work in a little pattern here. You're doing awesome. Do you feel any heat yet?
Not yet.
Okay, good. Okay. You're doing fabulous.
Yeah, I can definitely feel, because I had the numbing cream, and so I can definitely feel that it's like I don't feel the full effect because of the numbing.
Good.
It's good.
That's why we do it, right?
Mm-hmm.
So typically for our patients that want to do this procedure, if their schedule will allow for it, I'll encourage them to come in a full, 45 minutes to an hour before their treatment time. We'll put the numbing cream on. You can bring a computer, bring a magazine, bring a book. Do whatever you want to do while you get numb, and then we'll do the procedure itself. Some patients elect to get numb at home, and in that instance, we will call in a topical numbing cream for them to apply before they arrive to the office. Doing great.
And what would you say are the most common indications that you see?
I think for most
That you do
patients
this for.
that do this, it's really the anti-aging benefit. People want the skin texture improvement, just kind of a nice maintenance treatment when patients aren't really ready for surgery, but they're still wanting to do something to stay on top of their skin and skin tightening. And then I would say acne scars is probably the next indication that we see most commonly. And this is something also that Dr. Amaka can do in the OR for patients while they're asleep.
Mm-hmm.
Just kind of a nice thing that if someone's going to have surgery and they wanted to add something like this on and just not be awake for it, that's also a nice way to get this benefit as well.
Mm-hmm.
Great.
Because they'd already be asleep.
Yes. Then they don't feel it at all, and then you don't have to fool with our numbing cream. You're doing great. How would you say your pain is right now?
I'd say as it gets closer to the nose, it's a little more sensitive,
Okay.
but it's still tolerable.
Right.
Like, I don't even feel like I'm really flinching much. So.
No, you're doing great.
Mm-hmm.
So I've got you nice and dry from all this alcohol that I rubbed on you, but I'm just about done with this side of the face. You've done awesome. She's been a very...
Oh, pause. Oh, sorry, y'all.
We're back.
We're back.
Yeah, so radiofrequency is kind of a slow process as far as in terms of seeing results.
Mm-hmm.
Some of the studies that I've read show that it can be about 10 weeks to see some improvement. So, you're looking at 2.5, 3 months.
I think we have a question.
Oh, do you have a question, Victoria? Can you help us?
Yes.
You're doing great, okay?
Mm-hmm. It's at the all.
What is the recovery time?
Great question.
Okay, what is the recovery time?
Yeah, so recovery time is an awesome question. Most patients are going to find that they're going to experience some level of redness and swelling for anywhere from about 2 to 5 days. Everyone's a little bit different, so it'll shock me. Sometimes I'll have patients that they'll swear that they're good to go the next day, and then I have some patients that it takes the full 5 days to be back to normal makeup and normal skincare routine. But definitely redness and swelling is very typical and expected.
And for those of y'all just joining, we're doing radiofrequency microneedling. Tracy's doing radiofrequency microneedling on me.
And we are doing awesome. Dr. Maka's already had one side of her face done.
Mm-hmm.
You can see that she's kind of a little bit swollen. She's got kind of little track marks from kind of where the microneedle is kind of entered the skin there and delivered that radiofrequency. But she's been a trooper. We've had a full hour of numbing cream or so on there, and it's made it a very tolerable procedure.
And we have a comment to boss. That's I don't know if it says. I can't read it.
We can't read it.
Two boss babes right there from Gabe.
Do you want to use the ice packs?
Yeah, do you want ice, Dr. Maka, or are you okay?
I think I'm okay.
She's tough. I know, and this alcohol is it's probably more irritating than anything, but.
And then can you touch it so it doesn't time out?
Yep.
Perfect. Jackie and Cindy. Oh, Jackie and Cindy at Midtown.
Oh, no.
All right, so side 2, here we go. So I will have you kind of tilt towards me, Dr.
Okay.
Maka. But she did awesome. We got a whole 218 pulses on that side of her face. That's great. We like to be aggressive when we can. Okay, same as before. Here we go. Ready? 1, 2, 3. You okay?
Mm-hmm.
Great. So like I said, she'll have probably a few days of splotchiness, probably a little bit of puffiness and swelling. It's probably not going to be so swollen that anyone else would notice, but Dr. Amaka will probably see it in herself. Maybe a close family member, someone might notice a little bit. And then of course no makeup until the skin's fully healed, so she's not going to get to wear any makeup tomorrow for clinic. And then none of our regular anti-aging or skincare treatment type products until skin's fully healed too. You don't want to add any insult to injury. So take it easy. We'll use, just real gentle, mild soaps and cleansers and things like that until everything feels back to normal.
Tracy, did you talk about other areas?
Yeah, so face is a real common area to treat, but that Victoria makes a good point. We do a lot of other areas with the Morpheus as well. I've got quite a few patients that have after having babies and they feel like they've gotten they're kind of back to their post or pre-baby weight, but then still have some skin laxity. We've been doing a lot of tummies with that. We'll do sometimes like the back of arms after like a brachioplasty is a nice add-on. I've got some patients that have done like the tops of their knees, things like that. Really just kind of want to think of areas that are challenging to treat that have just a little bit of skin laxity, and those areas usually do really well. Also find that patients, on the body, it tends to be a little bit more better tolerated than if we do the face. The face and the neck are far and away the most sensitive.
Okay.
So I like that noise.
Can't see if we had any other questions.
Mo
I
says
need
she's
to-
next from Monica.
I need to get some type of facial. Okay. this isn't, I wouldn't really consider this a facial, but I've had facials, but this is, I kind of like the idea of microneedling is because I feel like it gets to a point where you're just layering product on product kind of on your face, but the product may not really be penetrating, so you kind of have to create a little bit of micro injury to do that, so.
Yeah.
But it's my first treatment ever.
She's doing awesome. She's a tough cookie. You're doing really well. We're getting closer here. Would you say that as I get closer to the midline, though, it is a little bit more sensitive?
Mm-hmm.
Now, could you imagine doing this without numbing cream?
Mm-mm.
Okay. So this is an important piece to that. Good to know. All right, you're doing really well. So the other thing that we sometimes get asked about this too is, who is this safe to do on?
Mm-hmm.
And this is really safe for patients of all skin types, all skin colors. The only folks that we really want to avoid or that we wouldn't treat, of course, we would avoid anyone that's pregnant.
Mm-hmm.
I don't know that it's been studied on anyone breastfeeding. It would probably depend on the patient's OB's recommendation. Probably want to avoid anyone that's got any kind of active infection, anything like that, because we are opening up the channels of the skin there. But by and large, this is really a great treatment for most of our patients. All right, I'm just going to get on your jawline there, and you'll be all set. You did awesome so far.
No, it's really looks good.
Manageable?
Mm-hmm. Very manageable.
Good.
Let me do this so it doesn't time out.
Okay. Another thing that we sometimes will treat with the Morpheus too is scars, like additionally acne scars. But a lot of times if I've got a patient that we're doing their face and they've might mention that they have a small little scar somewhere, we'll try to treat that too. Doing great. Couple more passes. Can you make sure we haven't had any other questions, Victoria?
No questions other than the comment of "you're such a boss," but we all know that.
We know that about Dr. Amaka. All right, you're doing great. Any problem areas that you would want me to hit again, just while you're done so well?
I think probably the mid cheek,
Okay,
like
kind
that
of where you've
halo
got
area.
that pigment right through here, and then we'll hit the other side too. So that's the beauty of this treatment too. It's very customizable. We could have ended it by now, but because Dr. Amaka has done so well and she's willing to let me go a little bit more, I'm going to try to just intensify her result.
And then what about frequency? Like how often?
Yeah, so we definitely recommend doing a series of treatments. I mean, there are patients that will just do one, but best benefit is definitely going to be seen with doing 2 or 3. Obviously, the bigger result that we're trying to get, the more aggressive we want to be. So I would definitely tell most patients to plan on at least 2 or 3. We space them usually about 6 to 8 weeks apart. I do tell patients, like, let's do your first one first, and then we'll plan on how frequent we want to do them, just depending on what kind of downtime the patient has. That kind of helps us plan better. You're doing great. We're getting close to wrapped up here. Not everybody does as well as Dr. Amaka. It's a little bit, it's a tender treatment, but you did great. Okay. I think you're good to go.
Awesome.
So she's a little puffy. I do feel tight.
Not really.
No,
I think
good.
once I feel the numbing effect on my lips and stuff.
That feels weird too, for sure. But so she's going to take really good care of her skin tonight. She's going to take it easy. I certainly don't want her doing any crazy exercise or causing any increase in her swelling. And she's just going to kind of baby her skin until it feels better and gets back to normal. All right, and then we'll probably repeat in about 8 weeks or so.
And I'll keep y'all updated on my progress through stories and lives and whatnot. So thanks everybody for tuning in. And thanks Tracy.
Yes, no, thank you.
Do I hit exit?
Yay.
I'm like, I've never done one.
But and now.